Hey everyone, welcome back to Purely Positivity. Today, we're diving into a hot topic that's been getting a lot of attention lately: Ozempic face. We'll discuss what it is, its causes, and the treatments available to help you combat it. So, let's get started. Ozempic is an injectable drug that was initially created to treat type 2 diabetes. However, it has gained some controversy as people started using it as a weight loss aid. According to Dr. Jennifer Levine, a New York-based facial plastic surgeon, Ozempic can be very effective for weight loss. It works by causing the pancreas to secrete more insulin, decreasing glucagon production in the liver, which suppresses appetite and slows down gastric motility, helping you feel fuller for longer. But what is Ozempic face, and why should you be concerned about it? Well, dermatologists and aesthetic doctors worldwide have started noticing the effects rapid weight loss can have on the face, particularly for those using Ozempic. Rapid weight loss can lead to volume loss in the face, affecting collagen and elastin in the skin, causing the face to appear gaunt, deflated, and saggy. Dr. Sophie Schotter explains that it's not Ozempic itself causing these skin changes, but rather the quick weight loss associated with it. With rapid weight loss, the skin struggles to shrink around your new shape, leading to excess facial skin that feels more lax and pinchable. Having some facial fat helps us age better, but excess facial fat can also create heavy lines, such as marionettes, around the mouth. The key to healthier-looking skin is maintaining a balanced weight. For those suffering from Ozempic face, there are in-clinic treatments that can help. Dr. Schotter suggests combining skin-tightening treatments like Subwave or Profound RF with facial fillers to restore volume and make the skin look healthy and proportionate. Biostimulators like H-Harmony-Ca can also be beneficial, using cross-linked hyaluronic acid to lift and volumize, along with calcium hydroxyapatite to stimulate collagen production and improve skin laxity over time. Dr. Levine follows a similar treatment protocol but also includes devices like Ultherapy and M-Face to help lift, improve sagging, and stimulate collagen and elastin production. In extreme cases, a face or neck lift may be needed to address laxity. It's essential to remember that prevention is always better than cure, so maintaining a healthy lifestyle and balanced weight can help you avoid Ozempic face altogether. We hope this video provided you with valuable information about this emerging skin concern. Be sure to like, comment, and subscribe for more Purely Positivity content. Thanks for watching, and stay positive.